Hi everyone, welcome back. So today we'll be discussing about one important topic, type 1.5 diabetes. So type 1.5 diabetes is divided into two types. First is ketosis prone diabetes and second one is latent autoimmune diabetes in adults, that is LADA. So ketosis prone diabetes or KPD is type 2 diabetes which presents as type 1 and LADA is just the opposite, which is type 1 presenting as type 2. So moving into the details, ketosis prone diabetes presents with DKA at a younger age, but when treated with insulin over a period of time, the requirement of insulin decreases and it could be managed with oral hypoglycemic agent. So in this case, initially it presents as type 1, but eventually it can be managed as type 2. Then LADA is just the opposite. Initially, the patient presents with slightly high blood glucose value without any symptoms and is diagnosed as type 2 diabetes mellitus and treated. But over a period of time, the insulin requirement keeps increasing and later on it behaves like type 1 diabetes. So antibodies are positive in case of LADA. And as we all know, fasting C-peptide levels are low in case of type 1 diabetes mellitus because insulin is the one deficient here in type 1 and whereas in type 2 it is because of the receptors. The insulin production is normal but the receptors are abnormal, and fasting C-peptides, the C-peptide is a part of the insulin molecule. So since insulin is deficient, the C-peptide levels will be low in type 1. So it should be less than 1.8 nanogram per deciliter to be diagnosed as type 1 diabetes mellitus. And moving on to some of the differences. So the LADA will be commonly presenting around 30 years of age, whereas KPD will be presenting in young adults around 20 years. And gender preponderance is mostly males in case of both, and antibodies are positive, very high, positive in LADA, and it will be minutely high in KPD. And the body weight, the person will be lean in LADA, and KPD, the person will be obese. And in case of LADA, the initial management, as we told, will be of type 2 diabetes mellitus, that is oral hypoglycemic agents, and later the management will be insulin. Whereas in case of KPD, the initial management will be insulin as of type 1, and later on it can be managed with oral hypoglycemic agents, just like how we treat the type 2 diabetes mellitus. So that's it guys. Tomorrow I'll be coming up with another new topic. Till then, stay tuned. Bye.